Hi, welcome back to Straight Talk with Tracey. Thank you for joining me, and Happy New Year to everybody. We are here today to talk about some common myths about eating disorders, and I am joined by Dr. Sarah Niego, a psychiatrist and the service chief for the Eating Disorder Transitional Living Program at Silver Hill Hospital and an expert on eating disorders. Thank you for joining me, Dr. Niego. So we've just been through the holidays, which for many people, most people I think, creates a lot of stress. And I imagine that that has a great impact, that stress being around family, focus on eating in a lot of cultures can have a tremendous impact on people suffering with eating disorders.
Absolutely. It is a stressful time of year for everybody in some way, whether it's good stress or, the bad stress. It is a time of families coming together, families who may not have seen each other for a long time, kids coming back from school for the first time, and a lot of comments from family, and a lot of comments about how people look, or a lot of exposure to food. Food is everywhere, and kind of pushing food or commenting on what people are eating, and then there's all the kind of body talk that goes with the holidays, and it's for someone struggling with an eating disorder, it's just the stress is compounded by a whole layer of other issues that people may or may not know they're dealing with. Right.
It's because for so many people it is hidden.
Yes, so that's very true about eating disorders. The way out of an eating disorder is to bring it out into the light, but eating disorders, because they're so protected, they're shameful to a lot of people, and there's the risk of having to give up the eating disorder if you tell people you're struggling with it. And so, yes, often they're not announced that clearly, and they have to be kind of figured out by family and friends.
Right. So let's start chipping away at some of these common myths that are part of our culture and part of the society. So the number one myth is that eating disorders only affect women.
Right. So that is a myth, and I think it's sort of becoming more. That myth is getting busted more, but people generally in the past have thought that eating disorders are disorders of women, that women struggle with them. There's an age range that is kind of the stereotypical eating disordered patient. They are young, upper middle class, Caucasian, female. Not true.
Right.
We know now that one thing we know is that eating disorders we see them in men a lot. So it used to be the statistic used to be 10 to 1. So 10 female for 1 male have eating disorders. Really, in a huge study in Norway recently, 100,000 people were studied. Of those, 1 in 6 or male with eating disorders. So 1 in 6 males had eating disorders, anorexia nervosa, and so we have to realize that what we think to be, what we kind of put out there to be the case, is actually being modified because we're learning and people are coming forward.
Is it more common anorexia versus bulimia or a binge eating disorder? Which is most common? What do you see most often?
So the statistics are that anorexia, about 0.5 to 1% of people have anorexia nervosa. Bulimia nervosa, 1 to 2% have it. And then binge eating disorder, by far the most people have it, 2 to 3% with binge eating disorder. And then there's the unspecified eating disorders that are also still a large category where people don't fully meet criteria for one or the other, but they certainly have an eating disorder.
And how would you distinguish between disordered eating and an eating disorder?
Yeah, that's a great question, because we are in many ways an disordered eating society. Huge percentage of people are at any given time on some kind of a diet or skipping meals, and that actually does not make them fully meet criteria for an eating disorder. Eating disorders are severe medical and, psychological issues that become a danger to medical stability and also impair functioning in a significant way. People cannot go to work, people cannot go to school. It impairs functioning on a different level. May start as disordered eating. A lot of eating disorders start as diets and then take on a life of their own for certain people, but not for everybody. So there's the distinction between who ends up with a full-blown eating disorder and who kind of pulls back and abandons whatever disordered eating they're engaging in.
Right. And do you have any statistics or anecdotal information about the co-occurrence of an eating disorder and other mental illness such as anxiety or depression or OCD?
Hugely comorbid.
Yeah.
Yes, and I do know that people with anorexia nervosa, about 40% have OCD. So it's a huge comorbidity.
Wow.
It is not, anorexia nervosa is not an anxiety disorder. We just know that often there is this type of person who will end up with anorexia nervosa is also the type that has high anxiety and is very rigid and perfectionistic, and often that goes with OCD as well. Very high comorbidity with depression, about the same amount, 20 to 30%, and substance. There is a huge overlap between people with eating disorders and people with substance use disorders. Now, the two are separate. You cannot approach an eating disorder, the treatment of it, with the same approach that you can to, say, alcohol use disorder, because they're different in essential ways as well.
Right.
But there's a huge overlap.
Interesting, yeah, because abstinence from substances, well, you would not want that abstinence from
can't.
food, right?
You
can't, right?
You actually need to abstain from starving yourself.
Right.
So, yeah, and the brain pathways, there are some overlap, but very different also.
Interesting. Number 2 myth, eating disorders affect adults only.
So that was, again, with that age range, it was kind of thought young adults,
Right.
upper middle class, female. We know that they're increasingly identifying eating disorders in very young people, school-age kids, 8 to 10-year-olds.
Wow.
10% of them, female, 8 to 10-year-olds, want to be thinner, think they're fat. We know that 8 to 10-year-olds are more worried. They've, in studies they've come forward, more worried about gaining weight and being fat than they are about their parents dying or about war.
Wow.
That's their life and death concern.
And how is that being seen in, say, an 8-year-old young boy or a young girl? Are they verbalizing that? Are they posting that on social media? How is that coming to light?
Some of them do. They talk about I'm fat, and they may try to cut back. And you may notice it at meals, that they're just saying they're not hungry, and they're skipping meals, and they really do attempt. And a lot of them can't do it, but there are some with the right kind of genetics in a certain brain that will continue and get stuck in the eating disorder. And the gateway to eating disorders is dieting in many ways. So yeah, we're just seeing it start younger. Wow.
And prepubescent young men and young girls and boys are naturally sort of hoarding that fat, right? They have that quote unquote, baby fat, right? So how does that affect neurological development if you're kind of starving and not letting that natural pubertal process happen?
Yeah, I mean, it affects neurological and medical and endocrine and all of that. So in terms of neurological, the starving brain is, if you saw it on an MRI, it's shrunken. It's smaller because it's not getting the sustenance it needs. So you imagine how it is to think with a brain that's starving. Right? We see it in our program, our Silver Hill, our eating disorder program, all the time. People who just aren't connecting the dots, and they aren't realizing things, and they can't really think, and they can't focus in groups. And then later they'll say, I just couldn't follow anything. And if their brain is fed, they start to make connections and have kind of epiphanies and realize things.
Wow. Amazing. Okay. Number 3, eating disorders are caused by the media, the myth of the media and social media.
Yeah.
Must have an impact, but certainly is it causal?
Yeah. So eating disorders, people are trying all the time to say it's because of the mother, or it's because of the environment, the media. It's all. I mean, eating disorders, like many things, are multifactorial conditions. They are serious neurologic, biologic, genetic conditions. They're, as you might think of something like schizophrenia. It's a brain disease, and it's also a genetically linked disease, and then there's the environmental impact, and it kind of all those come together, and results in eating disorders. They are not a version of any other psychiatric problem. They are an entity of their own, and they are multifactorial.
So what advice would you give people about the media images that we're flooded with from, I mean, we can't get away from it. The first thing that you see in the morning is these, your Instagram account or your Snapchat, particularly for younger people. What advice would you give for how to go on a digital detox, say, or how to vet the images that you are flooded with?
Well, one thing is just to media literacy. Just to know that those images these people may look, quote, perfect in the magazine or on the, runway or the TV show. Those images are highly doctored. Really, there are some sites that are worth looking at. The Dove campaign for True Beauty sites, they have little videos that show how a model sits in the chair before anything and looks like a very regular kind of person, and how much they doctor the image that you see in the end, including digitally. They lengthen the neck, and they, or with men, they accent the muscles, and they make them look like they look in the billboard, but they don't really look like that. And so that's media literacy. I highly recommend people realize that those images are not real.
Right. How about all this getting ready for the summer body and all of that? I mean, it's just, you can't get away from it. Everybody, especially in January, I know the day after Christmas, I took a ride out to Silver Hill, and the road was flooded with people that were jogging, and it was quite cold, so I thought that was quite...
Gyms are packed with
Gyms
new
are
fun.
packed, exactly. So everybody has this renewed interest in getting off all that holiday weight, but all in preparation for the bikini body.
Yeah, I mean, that goes back to the societal pressure, and actually eating disorders are, there is a certain degree that people buy into that, but still the majority of people may have joined the gym and have this attempt to lose weight, and maybe some people will lose a little weight, and then at some point, maybe later in the season, in the year, they will pull back and say, and they abandon the attempt to change their weight or shape. There are some who just, a small percentage, I mean, eating disorders are relatively rare, cannot, and they just, something clicks in the brain and they cannot let go of that eating, or they cannot allow themselves to eat, and it becomes medically a bigger problem.
Right, scary, yeah. Okay, myth number 4. You can tell by looking at someone if they have an eating disorder.
That's a big
judgment of our society.
Yeah, and actually in our eating disorder program, we're in a larger hospital context. People will bump into our patients in our program and say, "What program are you in?" And they'll say, "I'm an eating disorder." You don't look like you have an eating disorder.
Yep.
So that's a huge myth, is that you can tell from the outside if someone has an eating disorder. People, even people with the diagnosis of anorexia nervosa, may not look underweight. So you can't tell from the outside, and that people may look very healthy and they're actually quite ill. So that's a myth, that you can tell from the outside.
Right. So that's when measuring the level of impairment, or looking at how their eating or not eating is affecting their ability to function day to day. Right.
Yeah, and also talking to family, family aren't, that might be on that list, that this idea that family is to blame for the eating disorder. Actually, family are the biggest, support group out there. They are such an ally. They can be to the patient, the person suffering from the eating disorder. So, families often come forward or push the person to get help.
Yeah, and involving the family in treatment is important.
Absolutely necessary.
Yeah. We're going to take a quick break, and then we're going to come back and debunk some more myths about eating disorders. Thank you for being with us.
Yeah.
We'll be back.
For 1 in 4 Americans, mental illness hits close to home. And since 1931, Silver Hill Hospital has also been close to home. For individuals and families facing the challenges of mental illness, Silver Hill offers a highly trained, compassionate staff that provides state-of-the-art care in a beautiful and private setting. If mental health issues hit close to home, remember, there's a world-class psychiatric hospital right in the neighborhood.
Welcome back to Straight Talk with Tracey. I am joined today by Dr. Sarah Niego, who is a psychiatrist and service chief of the Eating Disorder Transitional Living Program at Silver Hill Hospital. And today we are talking about some myths about eating disorders. Thank you again for joining me. How did you come up with this list of myths, this extensive list that we're going through today?
You know, I took from somebody else to compile this list because there are many amazing people, researchers, clinicians in the field of eating disorders treatment, and I took from one of my absolute favorites. She's kind of superwoman to me in the field of eating disorder research. Her name is Cynthia Bullock. She is a psychologist who runs a program at UNC Chapel Hill on eating disorders treatment and research, and she goes around the world lecturing. She compiled this list of the 9 truths about eating disorders and myths, and kind of busted those myths. And she really she got to this list, and she got to the responses based on a lot of research. This isn't just kind of, oh, this is the dogma and this is how I'm fighting it. It's actually, my responses are based on a significant amount of real hardcore research, and that's important for people to know.
Right, yes. Okay, let's keep going. The next one is there is no such thing as FatISM. Overweight people are just lazy and eat too much. Oh boy.
Has anybody heard that one?
Oh yes.
I hear it all the time.
All the time, yes.
And it is, FatISM is a thing. It's out there, similar to other
Shaming.
things like shaming, things like other isms.
Yes.
So FatISM is absolutely out there. You hear people commenting, oh, I've heard people, any overweight person, any obese person obviously has an eating disorder, has a type of eating disorder. That's not true. People, body shape and weight is largely genetically developed, and to assume that people are overweight because they eat too much is just an absolute myth. People do that all the time, and it's really sad.
Yeah.
And then not just that, but FatISM, but kind of fat talk is out there. It's pervasive. So this is a big thing at the holiday, right?
Yes.
So, oh, I'm gonna have to go to the gym after this meal,
Right.
or oh, you lost weight. You look so great. That's all kind of fat talk that's out there that we have to be really aware of, because you don't know who's sitting at the table with you.
Right.
You don't know what they're hearing. An 8-year-old girl may think, when they hear you're saying, oh, I'm so heavy, I'm so fat, I need to lose weight, they may look at their own body and think, I have a stomach too.
Right.
So
Right.
FatISM, yes, and fat talk pervasive.
Right, yes, especially a young girl looking at a mom who is quite thin saying, oh, I'm so fat. That must be very confusing
Right.
to someone who doesn't yet understand about body type
Oh,
and
yeah.
weight and all of that.
Our mom or the teacher
Right.
or someone at the grocery store. It's all absorbed. Kids that age, they are like sponges, and
Right.
they really look at their own self in relation to what they hear other people saying.
Right, yeah. Okay. Number 6, eating disorders are harmless. Oof.
Yeah, they're just benign. They're disorders of vanity. People get over them. Things like that are also, that's just a huge misconception. Eating disorders are serious medical conditions, and people can look really well, actually, when they're struggling with an eating disorder, and be very ill underneath all of that. So.
Yeah, you touch on the medical aspect of it. What are some of the, I've heard horror stories about people that have done serious damage to their bodies by continual purging or restricting. What are some of the effects, the medical effects of a severe eating disorder?
Right. I mean, there is not one organ system in the body that is spared, really, from the litany of damage from an eating disorder. So it goes from all the way from the brain to the esophagus, the heart, the lungs, the stomach. All of those things are impacted by an eating disorder. People do end up, the biggest causes of mortality from eating disorders, and that mortality is high with eating disorders, are cardiac, whether it's anorexia or bulimia or something in between. cardiac, and suicide is a big one. And then there's the kind of sum total of damage to the body over time, which is a cause of just mortality eventually.
So folks with an eating disorder are really in a high-risk population.
So the estimates of mortality are upwards of up to 10%. Sometimes there have been estimates higher, 20%. 20%, I think those are the people that just ultimately succumb to anorexia nervosa over time.
Okay. Number 7, eating disorders is a choice, right? So these people are making a choice to be either too fat or too thin.
Right. Or, eating disorders are not choices. They are serious medical and psychological illnesses, just like something like bipolar illness or, like I said before, schizophrenia. They are brain diseases, and we look at the brains of people with eating disorders and we see brain pathology. We can kind of map it, and so we know that these are, again, psychosocial, multifactorial conditions. They are not choices.
Right. And yet there isn't a biomarker like in other disorders that we can say whether somebody has a vulnerability to an eating disorder. Is there such a way to mark if there is a genetic predisposition to an eating disorder?
We're moving there. We are. There are genetic studies. We've mapped the whole genome, and there are different parts of the human genome that do link to certain eating disorders, like anorexia. So
So we're getting there.
Just like we're getting there with a lot of other conditions. We will get there.
Yeah, I hope so. Number 8, the family is to blame. We talked about this a little earlier when you mentioned the media is to blame, right? So the family, it's how you grew up and how you were taught to eat or not eat.
There was this idea of the enmeshed mother, the over-controlling mother, and that the anorexic child was just claiming their own control in that context. And that might be a piece of it for some people. No, the mother is never to blame. In fact, the mother and the family is the greatest ally, the potential ally for the person struggling with an eating disorder.
Yeah. What is the treatment, the most efficacious treatment for eating disorders? How do people overcome an eating disorder?
Oh my gosh, that's a really big question.
I know. What are some of the common ways to be treated?
Yeah, I mean, it depends on what the eating disorder is, which type, what the person is doing. We do a lot of, first step medical stabilization. A lot of the times the person just needs good nutrition and medical stabilization before you can really get to, for some, refeeding. You can't really expect to do any true therapy in someone who is malnourished. And you can be malnourished no matter what your body shape or weight is.
Right.
So the first step is medical, stabilization and nutrition, and a good therapy, is very important. And the other misconception is that you can just be treated for an eating disorder and the whole thing can be wrapped up in a short period of time and you're on to, the rest of your life. That's rare.
Yeah.
A small percentage of people actually have one treatment episode and they're done with the eating disorder. But the larger percentages struggle for a longer period of time before getting through and out of the eating disorder, although recovery is possible.
So you can go into remission. The eating disorder can go into remission.
Yeah, we can call it remission or recovery.
Right.
But yes, there are people who recover 100% from their eating disorder. It's rare for that to happen in like 28 days. Our program is a 28-day program, and I tell everybody, do not expect to be done and this wrapped up and this fixed by the time you're discharged. It's really a beginning.
Right, the first step.
And recovery is possible, and never give up on anybody.
So family is the ally, they are not to blame, right? Number 9, biology is destiny, it's all genetic.
Right, so then you tell people that eating disorders have a genetic component. First step, mother usually blames herself, and then the person struggling says, well, why bother, I'm doomed from the womb.
Yeah.
That's not true. Biology is a part of it. Genetics are a part of it. And it's good for us to know that, because it can help with protecting the person from developing the eating disorder. It is a huge percent. I say, genetics loads the gun and environment pulls the trigger. Some people say it like that. But genetics do kind of predispose people, but they don't create the eating disorder. And actually there are a lot of opportunities for protective factors, knowing there's the genetics there.
So if it is hereditary or genetic, what are some of the ways that people can prevent that switch from being flipped on?
That's a good way to put it. Protective factors include things like if you need medication for anything, depression, anxiety, nutritional things, go for treatment.
Right.
First of all, be aware. Don't diet. Dieting is a gateway. If you know that there's eating disorders in your family, I highly recommend staying away from any dieting, and just seek treatment, or have the family should help their loved ones seek treatment early on. The earlier, the better.
Right.
Really, we know that the earlier you step in, the better the prognosis.
Right, right. So treating that anxiety or depression that might kick off the secondary eating disorder or make it a primary issue.
Or food fears, food avoidance things. There are people who have this very restrictive type of eating. They have phobias about certain foods, and have that recognized before it turns into something else.
Right. Is that ARFID? I've heard a lot
be.
about this.
Yeah.
ARFID is a new, funny name, a new term. Yeah.
ARFID, avoidant restrictive food intake disorder.
Right.
Often in younger people, but sometimes in adults we see it. And that isn't feeding and eating disorder, and it is in the category, and it can pose a real medical destabilizing picture.
So if you have a child who is what would commonly be called a picky eater, right? So they don't want foods to touch each other, or they'll only eat certain foods, or they're very restrictive in what types of foods they'll try.
Right.
What would you recommend? Is that something that should be looked at, treated, talked about?
Picky eaters, I don't have the statistics, but a very significant proportion of kids around in the age range between 4 and say 7, 8 are picky eaters. That kind of just extinguishes itself.
Okay.
But some people are just so rigid, some kids, and then adults become this way too, that it does start to become a medical condition, because they are malnourished, they lose weight, or the whole family is just solely focused on getting the kid to eat. And then it becomes something ARFID. And then you really can't diagnose ARFID if there aren't any medical conditions as a result of it. So vitamin deficiencies is one of those, anemia, malnourishment is a factor in ARFID.
Okay.
It's not picky eating. It goes way beyond just picky eating.
Got it. So if you're at your pediatrician and you're noticing some of these deficiencies that are not as common, or that would be a sign that perhaps you need to look at the intake.
Yep.
Got it. Okay. Number 10, people never recover from eating disorders.
That's not true.
Yeah.
The majority of people recover from eating disorders. I'll give you the kind of quick and dirty statistics. Right. About 20 to 30% of people who come for treatment for an eating disorder have that one treatment, and that's it, and they're done. They're over it, and they don't ever look back. Then about another 20-30% have come for treatment for their eating disorder. They do partially recover, meaning they can go back to their life, they go back to their family, they go back to work, their job, school, and they're able to function, and they might have periods where they relapse, and then they need to get treatment and restabilize, and that's how kind of their life goes. And overall, they're functioning pretty well with relapses and stabilization periods. And then there's this percentage, 20 to 30%, who actually have their first treatment and never kind of get past the eating disorder, and their life is really, really impaired by treatment and taking time away for treatment, or just not getting well in medical treatment. That's the group that raises the mortality. That up to 10 to 20% people who just never recover in any form from the eating disorder, but that's not the majority by
Right,
far.
right.
60 plus to 70% do recover, either full or partial.
That's wonderful news. So what resources, Dr. Niego, are available to people that want to find out more about treatment options and resources in their area? Where would you suggest people go?
Absolutely. Thank God for the internet now,
Yes.
because we do have a very powerful organizations that are spending a lot of their energy and effort researching and raising awareness and treating eating disorders. One of them is called the National Eating Disorder Association, and you get all sorts of information, for friends, for family, for people suffering with eating disorders. I highly recommend that site. There's the Academy for Eating Disorders. That's an international academy. And again, eating disorders are global.
Right.
It's not just a
US.
industrialized country.
Right.
And so that's an international organization doing a lot of research and trying to raise awareness and make guidelines for the modeling industry, things like that. Those are two websites I would recommend. There are lots out there, but those
Right.
are the two main ones I would say people should go on.
That's great. And I know that our website at Silver Hill also has
Yeah.
resources available.
Of course.
So,
Yeah, we do.
Well, I want to thank you so much for being here. It's a huge topic.
Yeah,
It's a
it
very
is.
interesting topic. There's just the ability to raise awareness about this and debunk some of these myths have been
Right.
really
I
helpful. So
know.
thank you so much
Thank
for
you so
joining
much for
us.
having me.
And we'll see you again next month on Straight Talk with Tracey. Thank you as always for joining me.